So uh, today I'll be interviewing Dr. Barnes, and I will have her start by introducing herself.
Sure. Thank you for having me. I'm so excited to be here and be on your platform and share with your audience today. My name is Reverend Dr. Xenia Barnes. I am an author, speaker, and social behavior scientist. I'm in Brooklyn, New York, and I support survivors of long-term illness, domestic abuse, and gun violence. But equally importantly, I coach. Um, Organizations how
Mhm.
to lead from a trauma informed practice so that they are providing the best services to their employees in order for their employees to be the best version of themselves at work.
Okay, that's very good. Thank you. Um, I'm excited to interview you and have you on my platform too. Okay, so I was wondering, I was reading the essay or article that you sent me. I was wondering what the main argument of the invisible battle regarding the workplace inclusion is.
Oh, awesome. So that is my essay in the anthology Triumph in the Trenches Volume 2. And that speaks about navigating the workforce as someone with invisible disabilities.
Mm-hmm.
And when I say invisible disability, that is connected to those who um, have mental illnesses or long-term illnesses that are not visible. Is just because you cannot see the
Mm,
wounds, the hurt, the damage doesn't mean that it's not there.
right.
And many people show up to work with a luggage set of
Mm-hmm.
trauma or things that they're going through in their lives, and is often met with lack of understanding,
Mm,
lack of compassion, um, and dismissiveness. And so the article speaks to what does that feel like for someone, like for example, for someone who is a grieving mother who's returned
mm,
back to work after however much time she had off, but is now faced with being engulfed in a space where everyone's doing celebration of life. There's so many birthday
yeah.
events happening around them, or the Sunshine Committee is doing a collection for someone who's getting ready to have a baby. Like all those type of things are triggering to someone who's returning from something like that. And so my essay taps into what does that look like, and then what does it look like to actually support someone who's experienced.
Okay, that makes sense to me. Um, I appreciate that you said what you were meaning by invisible disabilities because that's a very broad term.
Mm-hmm.
And like you said, it can mean many different things. For me, I live with nonverbal learning disability and I live with chronic migraines. Um, and so just like you said, it could be somebody's grieving a lost loved one or a friend, or it could be a learning difference like mine, or it could be many different things.
It can also be like for myself.
Mhm.
I am fully disabled. I have pulmonary fibrosis, lupus,
Mm,
um, minor bipolar as well disorder, as well as Sjogren's immune disorder. Now, if I do not have my oxygen on, you cannot tell that I'm
mhm.
disabled. So that's another form of invisible disability.
Right.
And once I was diagnosed and in the workplace, I was met with so much red tape and so many
Mm,
challenges, needing reasonable accommodations, which I also talk about in the essay, because
mhm.
my diagnosis and my disability was not visible to the naked eye. And so there was a lot of questions and there was a lot of things, that red tape that I had to like hopscotch over to get the support that I needed. And this essay speaks to that.
Yeah, I can imagine that. So how does your essay described the gap between intention and impact in workplace diversity initiatives.
Great question. So when you think about the impact, it's
Mm-hmm.
twofold. One it's not only the impact that it has on the workforce or on the employer, but it's also the impact that it has on the individual and those that they work alongside with. And
Mm-hmm.
so one misconception about it is just like, oh, um, if you just push through, you'll be okay.
Mm-hmm.
It's not that serious. Just fill out these papers. We're only asking you to so that we'll be able to document this
Mm-hmm.
term of documentation, which is becomes extremely triggering to
Mm-hmm.
someone who is battling some type of illness, or someone who is battling some type of mental health issue, whatever it is, when you are constantly being asked to relive it or re-explain
Yes.
it over and over again, the impact is detrimental to the psyche, because you're constantly reliving it. You're constantly going through this.
Mm-hmm.
You're going back to the doctor to, like myself, my illness is terminal. My illness is terminal. So it's not going to change in 3 to 6 months. So when my doctor first gave me the initial letter for reasonable accommodations to sit
Mm-hmm.
for work, and because they didn't understand my diagnosis, it was like, oh, okay, so we'll revisit this in 3 months. It says terminal, which means that there's no cure for it. So I'm going to continue to have it in 3 months.
Mm-hmm.
But yet again, I still had to, in 3 months, go back, get another letter, have, relive going through
Wow.
the doctor explaining that nothing has changed. Nothing is
Right.
likely going to change right now. Um, just the anxiety that you have with making those doctor's appointments, showing up to those doctor's appointments. So that has a huge impact on your mental and emotional state for the
Mm-hmm.
person that's going through it. But then also, it's a disservice to the employment, right? Because now I have to take that time off. You have
Yeah.
to take that time off, which means my work is not being done. So I'm not being the most productive. So all the
Mm-hmm.
things that the employer may be thinking that they're trying to fix by having you, oh, we need you here, and we need you working, and we need you on this project. They're actually
Mm-hmm.
delaying that process. And so that's why it's so important, and I speak about this in the essay. It's so important to understand that there's a bilateral impact
Mm-hmm.
when you're dealing with someone with an invisible disability.
Yeah. I can understand what you're saying with uh when you said, "Oh, you can just push through it." You can say that, but it's not as simple as that, right?
Exactly.
I mean, I can think of that with the migraines I have or with the challenges I have with my learning difference. And yeah, I've pushed through things before, but um, it's uh, it's hard to different degrees when you push through something because of whatever challenge you're trying to overcome. Um, so yeah, it's definitely challenging when you have, like you said, red tape and all different hurdles to go through and to re um, relive the trauma of explaining to a doctor or whoever you need accommodations from what you went through. That's not pleasant.
At all. And then there's also this piece in the workforce that happens with
Mhm.
people who are receiving this reasonable accommodations, right? Or RAs. Uh, there's this battle that becomes, or this tiff that becomes with those who work in person
Mhm.
against those who are working remotely.
Mhm.
As if you have this reasonable accommodation, it's a luxury to you. It's
Mm.
not a luxury that I'm sick. It's not a luxury that I have to be home to do the work that I need to do, because I can become extremely busy at the snap of a finger, or I can become, or I can, in my case, I can just randomly pass out. Now, if I'm in the office and that happens, then
Mm-hmm.
what? That is not only triggering for myself, but that's also triggering for those who are around me who has to experience
Of
that.
course.
And so that adds another layer to it.
Yeah.
You also have to think about when I say this force um cognition against with this resilience, that term that everyone likes to throw out. It's like, you're so resilient. Oh my goodness, I can't believe you experienced that. Yeah. And it's like,
Mm-hmm.
I'm not resilient because this is like a choice. I'm just like, hey, I can push through anything, like any adversity. When you're dealing with a invisible or even a visible disability, resilience is not a choice. It's a
Mm-hmm.
necessity. It's not, it's not something where we're just saying, I'm gonna get
Mm-hmm.
up today and my life is just gonna be different.
Yeah.
The reality is some days we have great days and some days we have really bad days.
Right.
Um, we are just learning how to love ourselves and be the best versions of ourselves
Yes.
day by day. Because if we focus only on our disability or our illness, we will be in a dark space all the time.
Mm-hmm. Yeah.
In a dark space
Sure.
all the time. And so the essay really speaks about that. And that goes along with the title, Triumph in the Trenches, because we're often in the trenches just
Mm-hmm.
because we're navigating so many different minefields.
Right.
And and from speaking like for myself, not only was I dealing with the red tape of it all,
Mm-hmm.
of getting the support that I needed as someone with an invisible disability at work, I was also dealing with the idea of constantly being dismissed as a woman of color, constantly having to like feel like that battle with self of, you know what, you can do it, you have to do it, because if not, then they're gonna feel like you're not as competent
Mm-hmm.
as the next individual. So there's so many things that as a woman of color you have to battle in the work field. um, as research has it, women of color are 2.3 less likely times than their counterparts to receive actual support for mental
Wow.
illness, for any type of physical disabilities or anything at work. So we already have that stigma and that lack of of accessibility for support on top of everything else that we're dealing with. So
Mm.
it's very difficult to show up and try to do your best when you already feel that you're unsupported.
Yeah. Yeah. Um, I can only imagine what those challenges are like for you as a person of color. I mean, I have friends that are people of color, and I- we talk about their challenges too, and it's good for me because I I don't have those sort of challenges. I have different challenges, of course, because I'm white, but it's good for me to see um, what challenges they have, um, and to try to support them with that. Uh,
It's always great to have an ally. Another key point when you think about
mhm,
having those conversations allows you to um, actively begin to make the choice to make change. Uh,
mm,
it's so important that, which is another thing we talk about in the book, which is so important to have action behind the words.
yes.
So it's easy to say, we're gonna bring awareness. We're gonna
Mm,
bring awareness to the idea of making sure that we have support for anyone who needs any type of accessibility. Um, we have enough awareness. We
mm,
need action. We need action. What action means is it means putting things in place, making sure that you have you're updating your guidelines and the
yeah.
handbooks, making sure that you are understanding that when someone is dealing with something traumatic, um,
Mm-hmm.
they may need to work from home so that they
Right.
can be in a space to process. When someone who is um, neurodivergent, right? When someone
Mm-hmm.
who needs to be in a quiet space because the loud noise is too much for them,
Yes.
that doesn't mean that they're incapable of doing what they need to do. It just means that they need to work in a different space. So
Right.
maybe making sure that you're allotting quiet spaces and quiet locations in the office so that those employees have spaces to go to so that they can work. We're not saying that if you can't have a sunshine committee. We're not saying you
Right.
can't have celebrations. We're not saying that don't invite us to the
Mm-hmm.
after work icebreakers or the after work get-togethers. We're just saying
Yeah.
there's times when we need that space.
Mm-hmm.
And we're just asking you to meet us where we are. When we ask for that space, allow us to have that space and allow us to have it with grace and not met with such resistance.
Yeah, I get what you're saying. I mean, I it makes me think of some of the accommodations I had in college. A I had extra time on tests and I had the ability to take them in a room either by myself or with fewer students because I needed fewer distractions, like you were saying.
Mm-hmm.
Um, and if it was a math test, I could have like a little cheat sheet of formulas so I didn't have to memorize all of them. I had my calculator, of course. And I had, what else did I have? I could have a note taker in class if I needed to. Um, but what I decided to do was I recorded the audio of my lectures
Mm-hmm.
uh, as notes, and then I also had audio textbooks, kind of like Audible. Um, and once I had all those accommodations beforehand, before I was diagnosed, my grades were C's, and then they went up to B's and A's. So obviously, they were helpful.
Exactly. And so those things shouldn't have to go away just because those things shouldn't
Mhm.
have to go away just because you're finished school, right?
Right.
Imagine taking those things into the workforce with you, how much more productive and
Yeah.
how much more confident you would be in certain spaces. You would have that confidence of owning the room,
Mm-mm.
commanding the room because you feel like you're really prepared. You don't feel
Yeah.
self-conscious. You're not self-sabotaging by doubts and overthinking yourself with a presentation arrive because you're hoping that you remember everything. But
Mm-mm.
you have these tools at your accessibility and ready for you to be able to use to lean on so that you can be more comfortable and confident.
Yeah.
And that's what's so important about my essay. It's about you can allow space for that
Mm-hmm.
without the judgment.
Yes.
There's space for all of us to grow. There's space for all of us to grow. And Triumph through the trenches is about that. Triumph in the trenches is about understanding that everyone has some different form of challenge that they go through.
Mhm.
But it's important for us to recognize and come up with systems that actually work
Yeah.
instead of having the systems work against us.
Yeah, that's a good way of putting it. What I was when I was reading your essay or book, I was reading about Sarah and I was going to ask you if you were if you could talk about some of the challenges she went through because she's uh, in the essay you said she was a software engineer with autism, um, and she like what challenges she faced in her workplace with inclusivity.
Right. And so in that section in that expert, it was about Sarah recognizing that there was many people who judged the fact of what they believe autism to be. I'm sorry, I'm getting
Mhm.
tired tongue. Autism to be, and because of their perception of what they believe autism to be, it kind of contradicted all the work that she was already capable to
Mhm.
do. And so the challenges was always having to feel like she needed to do more, you know, do more to prove herself. And then on top of that, it's like it was also that battle of feeling muted sometimes, that battle of feeling not only not feeling enough, but that battle of feeling like who's showing up for me when like you knew that these were the challenges I came with. I
Mm,
expressed these challenges to you. I expressed the things that I need so that I can be successful. But now I'm being met with resistance when it doesn't a cookie cutter example of what you think an engineer should be. Um,
yeah.
and Sarah was awesome at her job. Her reviews were, her performance reviews were always awesome. So it's
Hmm.
not that she was incapable of doing the work. It was a matter of constantly being challenged against others who felt like she got special treatment
Mm,
because they didn't understand why she needed to get have certain services or have office space to herself in certain times when others didn't have it. And so that's why I had that piece in me where I say you don't want what I have, because people often when they can't see bruises or they can't put a
mm,
finger on exactly what's going on with you, they come up with all these assumptions. And it's like, well, I don't need this to do X, Y, and Z, but you don't want what I have. You're going to want to have to live through the challenges that I actually, or in Sarah's case, that Sarah actually has to go
mm,
through day to day to even prepare herself to get ready to show up to do the work because she knows when she gets there, these are the challenges that she's going to be met with. She knows when she
yeah.
gets there, she has to deal with the condescending comments or the someone asking her 3 times the same question because they think that she can't comprehend the first time. It's
Mm,
like that's not what my autism is about. My thing, what Sarah, her thing was like she thought faster than other people and she just needed 5 spaces so that she can be able to do what she did. She was socially awkward. She was
mm,
socially awkward. And so she wasn't comfortable with being in large groups and
mm-hmm.
things of that nature. That doesn't make her any less capable of doing her job. It doesn't make her any less productive because she needed to work in a separate space or for someone else. Um, it just means that she needed to work differently.
Yeah. Yeah. That makes sense. I mean, I know for me, uh, I worked quite different than some of my colleagues. Like, I usually have music on in the background when I work because it helps me focus. Um, because if I don't have something on to like block out, it's hard for me to focus sometimes. So I can understand um what you were saying about Sarah with her different accommodation or needs.
Mm-hmm.
And it's it's definitely true. One of the things you reminded me of when you were talking about Sarah is when you've met, there's a saying, when you've met one neurodivergent, you've only met one neurodivergent. And I think that's true for a lot of other labels because so we're all so different in many different ways. And, it can be um, it can be used for many different labels. But um, I was also wondering why the process of requesting workplace accommodations is described as a bureaucratic minefield.
Oh, that is a great one.
Yeah,
And
that's enough.
I intentionally wrote it that way and named it that way because when you think of a minefield, you think of all the little things that you have to look out for, the explosive.
Mm-hmm.
Think about all those things. But then you also have to think about when you bring it to the workplace, that's when the bureaucratic comes in because there's so many different tiers and levels that you have to go through. And this one, this supervisor has to answer to this supervisor, this leadership team member has to answer to the board. And
Mm-hmm.
there's all these different people who are now becoming a part. They're now becoming a part of your story. Um,
Mm-hmm.
but it's not almost, it's actually them looking from the outside, not really trying to see what
Okay.
you're experiencing on the inside. So it's easier from a distance to deny someone and say, oh, I'm not willing to let them work from home 3 times a day. I want them in the office. I want them in the office 3 times a week, and they can work from home twice a week. Or I
Mm,
prefer, you know, so it goes on their preference. Like I prefer that this person is in 4 days a week because I don't believe it's fair to other people that this
mm,
person gets to work work from home 4 days a week and come into the office when everyone else has to come in. So it becomes this, and that's why I say bureaucratic, because it becomes this challenge of and nuance of going through the particulars of other people's preference
mm-hmm.
who are challenging the challenging the decision and the determination that your professional doctors already put in place for you and say these are the things that this person needs. And so they're questioning not only you but questioning the doctor's um, perspective of what you need. And then it's also that battle. It's that battle of, well, are you willing to compromise? Are you willing to reschedule your doctor's appointments so they're happening later in the day and not during the morning? And it's like, that's not my choice. If I could get my doctor's
Mm-hmm.
appointments, anyone who has ever made a doctor's appointment knows that you do not have like autonomy around the time. You may think
Yeah.
you do, but you don't. It's like, okay, um, I would love to go to the doctor on Monday between the hours of 3 to 6, but then the doctor's schedule is like, oh, well, actually, the next Monday they have available is not until 4 months later. Now, if you need to go to see a doctor now, you can't wait 4 months later.
Yeah.
So you have to take the appointments that they have. And so,
Right.
although that was, that's a perfect example actually because that's
Mm-hmm.
what actually happens. It actually happens even when you're at the hospital and they say follow up with your physician and within the next 7 days, and then you call your
Mm-hmm.
doctor's office and they're like, well, sorry, the doctor doesn't have anything available for the next 3 to 6 weeks. So that's real life. Those are real life things that
Yes.
happen, which adds to the minefield, right? It adds to the minefield. But then you also have to, on top of that, you have the forms that you have to fill out. There's like
Mm,
this laundry list of forms they want you to fill out. How many doctors are you seeing? How often are you seeing the doctors? Um, then you need the doctor's information. You need to know
mm,
how many tests that you're gonna have to take while you're at the doctor. How much time are you gonna need? So there's all these different levels when they
mm-hmm.
already receive a package from your doctor that says, hey, this is the diagnosis. This is how many times they have to come in to visit for these appointments. And they can actually use that. They can use that initial letter to fill out the complete pack, fill out the request. However, they continue to make you fill out all of these
Wow.
forms, form after form after form, which is can be very triggering to someone who is extremely ill or
Mm-hmm.
someone who is having a manic episode,
Mm,
with someone who it falls into so many different categories depending on your level of whatever your disability is. And not everyone has tremendous support.
mm-hmm.